because some patients are said to be recovering. Kojo Yangsin is a member of the health desk here at JoyNews, and he's been speaking to the medical director at the Greater Accra Region Hospital, Dr. Emmanuel Srofenyo.
So, well, there it is. That's the isolation center here at the Greater Accra Regional Hospital. Now, Dr. Srof, tell us about this center. What's the capacity?
Yeah, unfortunately, this place is a very well-designed center. Each of the patients has its own area of to stay. It's self-containing, and you have your bed. You have the necessary gadgets in the room to monitor you. You have a hand sanitizer. You have your own washroom, your bath, and then your sink where you can wash your hand. Unfortunately, we have the capacity is such that we can take only maximum of 4 persons at a time. So that is one of the drawbacks of this center. It is well designed, and the environment is perfect. The isolation is so good from the main part of the hospital, but the capacity is small. That is 4.
How many patients do you have there at the moment?
Currently, to the best of my knowledge, about 2 patients are there currently.
Okay.
Yes.
What can you tell us about those patients?
Well, they are generally doing well. They are being kept there more for the purposes of isolation to minimize contact with other people. That is the main reason, not that they are particularly sick. No, we are not even giving them any major treatments, but basically for the purpose of isolation, so that they don't contact more people and create more problems.
Are they better now than they were when they came in?
One of them is better. The other one was not bad when he came, and is still like that. One who had a temperature is now far better than she came in.
Okay, so that's 1 male, 1 female.
Yes.
Okay, which of the cases, can you tell us which of the cases the public is aware about that you are keeping here?
Actually, we are not we are not allowed to give any details unless it comes from Ghana Health Service headquarters. The headquarters itself, when they feel that there is a critical information that they can give to the public concerning particular patients, they are the ones who are mandated, because we want to avoid confusion in the minds of the public. And so, as you can see, even Ghana Health Service is not the one who is communicating. It's the minister, the Honorable Minister himself, together with the Minister of Information. They are in charge. Well, our job is to gather information sent to the headquarters, and their job is to do the communication.
So how many staff do you have looking after the patients you have at the moment?
Currently we have 2 nurses there, and they are the disease control officers. They are also around on duty currently.
Any doctors?
We have doctors too. They are not there physically, but they are on call. They are around. They are around the environment.
So at the moment, would you say that they have everything they need to manage these 2 cases?
Yes, they have. We have everything we need to manage those 2 cases, but things can easily run out, and so we do know that our superiors within the Ghana Health Service headquarters are working around the clock to get the additional logistics that are needed. Those other logistics that are within the domain of the hospital too, we are also working hard to make sure that those other logistics are provided, so that the place will run continuously. What we have been able to achieve so far, for the past 1 week or so, we've been running the place continuously. So at any point in time, there are staffs who are working there, whether we have a patient or not. There are staffs, because we can have a situation where middle of the night, a patient is rushing.